Huh? Where am I? What's that? A monster? A ghost? Food! Oh my god! Oh, am I alive? Shh. Keep your eyes closed. I have something to show you. Huh? Who are you? Your prayers have been answered. Let me tell you a story. Once upon a time, in the middle of nowhere, there was a village. This village was a very ordinary village, except for one thing. You see, this village was haunted by a beast who had a disastrous love for food. Every day, he would prey on the village and the surrounding area, destroying everything and killing many. The villagers were desperate to save themselves, so they did a war dance and prayed to the gods every day for a savior. And the gods responded with the prophecy. The cause for the beast is in chromosome 15. Because of this, the beast will never be lean. The craving for food will never end, but a savior will come and give a hand, and seize this pattern of abnormalities and described by Prader and Willi. Today is the day the village will be saved. You asked me for this, and I'm fulfilling your wish. Watch and learn.
So you see, we are being haunted by this beast, and the gods have sent you to save us. Have mercy.
Oh, I see, but I'm a doctor. I save things, not kill them.
Hey, Doctor, perhaps you can help us decipher the prophecy for us. We do not understand what the chromosome 15. It is the cause of the beast as the prophecy has stated.
Haha, chromosome 15 isn't a location. Chromosomes are thread-like DNA molecules made up of genes. Genes are encoded DNA instructions.
What's DNA?
DNA is an acid that carries all your genetic information and gives instructions for making proteins. Basically, DNA is the story of your life.
I do not understand. How can the cause of this be in a chromosome?
A chromosome? Well, it might be a genetic disorder.
A genetic disorder?
A disorder that occurs because of mistake in the genes. There are 4 types of genetic disorders. Chromosome abnormalities, single gene defects, which occurs because of mistake in one gene, multifactorial problems, one caused by genetic or environmental factors, and teratogenic problems when birth defects occur. It seems like this is a chromosomal abnormality, according to this prophecy you speak of.
This is impossible! His craving of food will never be satisfied.
Craving of food? Does your beast perhaps look like this?
The drawing is mediocre, but yes, mostly.
Anyways, I think your beast has Prader Willi syndrome.
Prader Willi syndrome?
Prader Willi syndrome is a genetic disorder. Although the reason for the occurrence of this disorder is unclear, the genetic error is known to be in the 15th chromosome. Usually, all chromosomes come in pairs, with one from the mother and one from the father. But for victims of Prader Willi syndrome, the 15th chromosome is missing, or the child has 2 copies of the same 15th chromosome from the mother. The disease is named after endocrinologists Prader, Labart, and Willi, who were the first ones to publish a report describing this unusual pattern of abnormalities.
And these abnormalities include mass murdering and eating?
Well, usually, victims of Prader Willi have an uncontrollable craving for food.
Do they also happen to have bad motor development, poor responsiveness, poor eye coordination, little muscle tone, and are short and fat?
Why, yes, and sometimes at birth, male infants have undescended testicles. Children with Prader Willi syndrome also have a slow growth and physical development, which results in a short stature and small hands and feet, delayed motor development, and some learning disabilities. Also, after birth, symptoms of Prader Willi syndrome can be seen in 2 stages, the first year of life and in childhood. Oh, Mr. Homework God, I almost forgot you were there. Anyways, FYI, during the first year of life, many distinctive physical features of Prader Willi syndrome may develop, including poor muscle tone and its distinctive facial features that guy talked about. Children rapidly weight gain and are obese because they eat so much, leading to type 2 diabetes, joint and lung problems, and high blood pressure.
Oh my, it describes the monster perfectly. This is wonderful. Now tell me the cure.
There's no cure.
Then how are we supposed to live?
Fortunately, there are now treatments that can treat the symptoms of Prader Willi, unlike the times before modern medicine, where there were no treatments at all. Because Prader Willi syndrome has no current cure, the treatment of Prader Willi is based on the treatment of the symptom. Nearly all Prader Willi victims have poor sex and growth hormones, so the patients are treated with human growth hormone, which not only increases height, but also decreases body fat and increases muscle mass. The biggest effect of Prader Willi syndrome is obesity obesity and uncontrollable intake of food, and is the largest obstacle keeping Prader Willi victims from leading a healthy, independent life. There are no medications that can treat the craving of food that patients experience, so the only ways to control this craving is manual constant supervision in a strict environment. The guide forgot to mention that there are, however, medications that control obesity, but these medications will do nothing to stop the uncontrollable eating of Prader Willi victims. Because Prader Willi victims also have slow and weak overall development problems, many patients go through a range of therapies. These include physical therapy to include movement and strength, speech therapy to improve speaking, and development therapy to earn skills that a person of that age should know, such as social skills. Although there are treatments that can help people with Prader Willi be socially independent, many Prader Willi victims need constant supervision their whole lives, and must live in residential care facilities.
You expect him to constantly supervise him? That's impossible!
You could use the human growth hormone. 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 You also have advertisements? Well, we have to have a way to earn money.
But we don't care about reducing body mass and increasing height. How do we even know that the monster has this disorder anyways?
The most accurate way of detecting Prader Willi syndrome is with a methylation analysis, which is detected 99% of cases.
My brain is too small for that. He probably has it anyways. How do we live in fear all day? We are doomed!
Actually, there is research being conducted to find a cure.
What? Really?
Well, none of the research was successful.
Tell me anyways.
I doubt you'll understand it, but there's no successful research for the cure. The scientists are discovering things to treat the symptoms. Anyways, in research studies today, scientists are excited about 3 pharmacological substances that may or may not affect the Prader Willi syndrome. The 3 products are oxytocin, modafinil, and Zenatide. Current studies published in Orphanet Journal of Rare Diseases show that oxytocin could improve behavior, mood swings, and trust. Current studies have also shown that modafinil is safe in treating daytime sleepiness present in Prader Willi patients. Zenatide may increase satiety and weight loss in adults with Prader Willi. There are also studies being conducted for the purpose of finding out what exactly causes the food craving and obesity seen in children with Prader Willi syndrome, and what causes and how to cure the scoliosis sometimes seen. Why yes, one study published in Clinical Endocrinology suggests that the reasons children with Prader Willi syndrome have an uncontrolled desire to eat is because they have an impaired autonomic nervous system, which also explains their high risk of cardiovascular disease. It was done by comparing 10 adults with Prader Willi to 10 healthy obese adults.